Well, welcome. Thank you for having me, Colleen. I'm excited to be here. Yeah, this is a hot topic, I think, for all of us. And let me get to the next slide. I'll start talking right away. There we go. Okay, just to let you know, who am I and why am I here talking to all of you? I am the wife and the mother of 2 boys. I have an older son, a 14-year-old son with autism. He's in the SLC classroom here at Cobb Middle School, so he is not high functioning, he's lower functioning, and I will be sprinkling in lots of examples of our life and how we use some of these strategies, so hopefully it will be helpful to all of you. I also have a 7-year-old little boy in 2nd grade, and he's a ton of fun, and he's a great little brother to our older son, which we're very lucky about. Just a little bit of background about me. I got my undergraduate degree in psychology, and then I was in the business world for 7 or 8 years. I did business and computer technology consulting, and I had Sean, our first son, and then he was diagnosed when he was about 2 with autism, and we started ABA therapy right away, and we saw lots of improvements and lots of progress, and I can get into a lot of details on that later. Then I kind of decided to get back into that field of psychology, so I went back and got my master's and got certified and became a BCBA, and now I've been working with preschoolers, students, adults, and I just absolutely love it. So I kind of have the professional experience, and then I'm also a parent. I come from it because I understand what you guys are going through and, you know, all the different challenges that come with it. So, and then I started Stepping Stones about a year ago, and I've got my clients, and then I love doing presentations like this to help out parents. All right, this is the basic outline of what we're going to talk about. Can you guys see that? No. Yes and no.
Turn the light out. Well, the one closer here, it blocks your video. So, oops, sorry. Is that better?
Okay, not too dark for, okay. Is it too dark in there? Okay. This is the outline we're going to talk about. We are going to talk about what ABA is. How many of you are familiar with ABA? Okay, not a lot of you. How many have had some ABA therapy or services for your child? Okay, so there's a handful of you. So there's plenty of you that are not familiar with this at all, correct? Okay, so I'm going to go through kind of a basic introduction of ABA, some of the basic principles. I went through this with my husband, and he accuses me I tend to get a little technical, so please stop me, and I'll try to I'll talk in real words and not get too technical on you, if I promise, or I hope. So we're going to talk about what ABA is, some of the key principles, and then we're going to get into some of the home strategies as well. Okay, so what is applied behavior analysis? I've put the official definition up on top here, and I think I don't know if you can read it on your notes. Applied behavior analysis is the science in which the principles of the analysis of behavior are applied systematically to improve socially significant behavior. So what does that mean in real words? What this means is we use some basic principles of ABA, and we're going to talk about a couple of them here, one of them being reinforcement and punishment. I'm sure a lot of you have heard about positive reinforcement, negative reinforcement. We'll talk a little bit about punishment. Those are used a lot in our world on you know, working with kids and adults with special needs. We're going to talk about the functions of behavior, trying to understand why the behavior is occurring, and then how do you handle the behavior once you understand and identify what's the actual function of the behavior. The other thing I see with ABA is basically what you're doing is you're trying to analyze behavior and change behavior. And we're doing that all the time, actually, with our typical kids, with our spouses, with whoever. What we're trying to do is increase good behaviors, preferred behaviors, and decrease undesirable behaviors. So for kids with special needs, sometimes it's just that simple, that's something that we want them to do more, and it might even be learning some new skills, learning new academics. It might be how they are able to sit at a table. We want to increase that behavior. And then at the same time, we're decreasing undesirable behaviors. Maybe those behaviors are running away, hitting, you know, not able to sit still, and we're going to talk through some of those things. So the key to ABA is really those 2 points. That's very simple, but that's what it boils down to, is increasing desired behaviors and decreasing undesired behaviors. And then improving what they call socially significant behavior. And the reason I think this is important is a lot of times there's a checklist of items that kids are supposed to be doing, correct? There's a list and you want them to be coloring or identifying letters and identifying numbers, and obviously we want all of that. Sometimes there's behavior that is just appropriate for a family, for a child, and it's socially significant, and it might be, and I will give you plenty of examples about my child. He actually is a performer, and I'll tell you about that later. He has ABA goals where he needs to learn to stand with 2 feet and hold a microphone and sing and not say cheese when somebody's taking a picture. Because what do? Every time you see a camera, you say cheese. He was singing a song, and in the middle of the song, he would see a camera and just say cheese. So through ABA techniques, we actually he learned it because everybody says, say cheese, correct? So we had to unlearn that for him. So this is not something, obviously, you're going to see on any checklist, but it was relevant to us, and we used ABA principles to help unlearn that, learned behavior. So it's important to know that there could be something very specific and personal to your child that needs to be changed, and that's all included within ABA. And it is data driven. That's a big part of what ABA is, and I'll give you an example of that. So, you might say, we want your child to learn his letters. Now, that's not a good enough goal in the ABA world. What we would say is something along the lines of, when shown the letter A, the child says A, 90% of the time for three consecutive sessions. You would do that for every single letter, and now the child knows letters. So it's very data driven. So you don't just say, oh, he knows A. We need to see the data that shows that this child knows the letter A, B, C, and then you go with the letters, and then you move towards reading, and then reading longer passages, then you go to reading comprehension. But it starts at those small points, but every single time it's run through data. So I thought I'd throw in some humor in there. So I don't always take data. Yes, I do, actually. So we always take data, and that's a big part of applied behavior analysis. Okay, so how does ABA help? Like we said, we increase a lot of preferred behaviors, and these are some examples up here. Communication skills, and that could mean anything from a verbal child trying to tell you he needs a break, or to tell you he needs juice, or even nonverbal children and having them work with an iPad on Proloquo and telling you their basic wants or needs, or even understanding how to say yes or no to things. So you want to increase communication skills, social interaction. We talked about all kinds of new skills you can learn. Interactions within the community setting, going to a grocery store, going to a restaurant, and then also generalizing these skills. So skills that he's learning at home, you want him to be able to him or her, you want them to generalize these skills out in the community, and then skills that are learning in the school, you want them to be able to generalize those skills in the home setting. So this is what we'll do with desired behaviors, and then hopefully reduce undesired behaviors. And this is what we're going to focus on today. Maybe a lot of you look at this list and see your children somewhere on that list for whatever reason. Aggression, keeping your hands to yourself, staying quiet, maintaining self-control, escaping, and learning to accept no. And then we're going to talk a lot about these behaviors today, and hopefully some tips on reducing these behaviors. Okay, key principles of ABA. You guys tell me if it's too technical. Okay. I will skim through this. The reason I'm bringing this up is because this is a big part of how we decide how to manage a behavior, when we're going to focus now on challenging behaviors. But we work a lot with reinforcement and punishment. And reinforcement is what it sounds like, is you want to increase a good behavior. Punishment in the behavioral world has a very different meaning or connotation than in the regular world. Punishment simply means reducing a problem behavior. That's it. So there's 4 different squares that things will fall into: positive reinforcement, negative reinforcement, positive punishment, negative punishment. Positive reinforcement is pretty much exactly what it sounds like. And I'm going to give examples on the next slide. You want to increase a desirable behavior by providing something that's, you know, preferred or valuable to the child. A negative reinforcement would be you want to increase that behavior. You want to increase a good behavior, but you're removing something that's undesirable for the child, and that will get them to increase that behavior. Again, you guys don't need to memorize this. This is just giving you an understanding of how we think and how we decide, you know, how to handle certain behaviors. Positive punishment is you want to decrease a problem behavior by providing something that's aversive. And then negative punishment is trying to decrease a problem behavior and unpreferred behavior by providing something, or sorry, removing something that is valuable to the child. So this kind of explains the positive reinforcement, negative reinforcement, positive punishment, negative punishment, and how we handle it. Again, you guys are not getting quizzed on this. You don't have to worry about it, but it's just giving you an idea of what the basic principle is. And here are the examples, so this makes a little bit more sense to you. The positive reinforcement is fairly straightforward. The student complies and follows directions and gets verbal praise, and they're excited and happy, and hopefully they do this again. Same thing, waiting nicely, they get a treat. Now, negative reinforcement would be the student cleans up his desk without asking, and the teacher removes a demerit. So you've removed something that's aversive. The demerit is not something the child wants, so you remove it from them. So this would be a negative reinforcement. Positive punishment is pretty much what it sounds like, is the child does something, student runs out of the room and gets yelled at in front of the class. So this is aversive to the child, and hopefully they don't do this again. Negative punishment, let's say the child pushes the sibling and an iPad is taken away. So the iPad is valuable, so you're removing something. Timeout is a perfect example of a negative punishment. So you're removing the child from a fun environment. You're not providing them with any attention at that time because they've done something they're not supposed to do. So hopefully they don't do that behavior again. Am I getting confused looks, or everybody's kind of getting it, or? Yes?
It's okay to shout it out.
You can say, yeah. Okay.
Yeah, I'm really confused.
You're confused? Okay. Okay.
So, what is like negative reinforcement? It looks like the same as positive punishment. No?
No, because negative reinforcement is you're wanting them to increase a positive behavior.
Give examples. Real life examples.
Right, you like the examples. So negative reinforcement, I'm going to get to a very good example of, let me see, so negative reinforcement would be, let's say the child, here's a great example. The child, you're asking the child to do some work, okay? And he's having a tantrum or a fit, okay? And you're not going to accept that as, you're not going to let him get out of something, right, because he's having a fit. You want him to say, I need a break, please, okay? If he says, I need a break, please, now you can say, okay, we will take a break. You don't need to do this right now, if he says it nicely. Now, the reason this is negative reinforcement is you are reinforcing him to say, I need a break, please, next time, instead of having the tantrum. And now you have removed that demand from him at that moment because he didn't feel like doing it at that time. Does that make sense? Okay. Again, you don't need to fully understand this. This is just to give you an idea of where we're coming from. So yeah, and if anybody wants to talk about it more later, we can do that as well. Okay. So how do we use this type of principle to manage some challenging behaviors? Now, the very first thing we do as BCBAs when we're talking about a challenging behavior, or we're talking to parents about trying to, work with a challenging behavior or reduce a challenging behavior is there a replacement behavior? Can we identify a replacement behavior that can take the place of that challenging behavior? For that example, let's say you don't want the child tantruming. You don't want them getting out of something with a tantrum. You want them to be able to sit quietly and ask nicely for what they want. Then they get what they want. So what you want to do is you want to try to find a replacement behavior that can be done instead of the tantrum or the yelling or the aggression or whatever it is. And I'm going to give you a perfect example of this right now. My son, my 14-year-old, sings in perfect pitch. He has a very sensitive ear to music, and so he's been singing at different events now, which has been fun and fantastic. But when he was younger, he did not want us singing at all, because I think he was so sensitive and he had this perfect ear. Anybody else singing really upset him. So if we started to sing, and this was, I don't know, what, 5 years ago, maybe he was 7, 8, 9 years old, we would start to sing and he would literally lunge at us screaming, you know, like, "Wah!" You know, like, no, you know, he did not want us to sing. So now there's a couple different ways to approach this. We could punish that behavior, he could get in trouble, and we could take something away and say, don't ever do that again. Now the more productive way, and this is what hopefully a good BCBA would do, is find a replacement behavior that solves his problem, that's appropriate and acceptable, and the other behavior hopefully gets eliminated. So what we would do is we would just ask him to say, please stop singing. And he could read, so we would have, it would be called a textual prompt, it would be like a visual. We would show a sign that said, please stop singing, and we would put it in front of him and ask him to say it, and we would keep singing. So again, and this is where my husband's like, quit saying reinforcement and punishment, but this would be negative, a negative reinforcement. Because what we're doing is we're trying to get him to say, please stop singing, instead of lunging at us. So we'd say, Sean, just say, please stop singing, and he wouldn't do it, and he would lunge, and he'd lunge, and we'd keep singing. First time he would say, please stop singing, we stopped. And so he would learn, and it takes a long time. These things don't happen overnight. So when there is a problem behavior, especially one that's been around for a long time, and there's a history of getting attention or getting out of things or something, and if it's been going on for years, it doesn't happen quickly, and it takes a lot of consistency, and we're going to get into all of that later as well. Let me finish, and then. So what we would do is every time he would lunge, we would just keep singing until he would say, please stop singing, and then we would stop singing. Well, guess what? He hasn't lunged at us in years. I mean, I was talking to my, we were running through this, and he's like, I can't remember the last time he's lunged at us. He still says, please stop singing all the time. We don't even realize, like, we're humming along to a song, and he's like, please stop singing, So it still bothers him, but he's learned that if he lunges, that's not gonna work. So this is a perfect example of trying to find and identify a replacement behavior for your problem behavior. And most of the time, it's because they want something, or they're trying to get out of something. And if you can teach them a way to ask nicely, behave appropriately, and then get what they want, hopefully the other behavior gets eliminated. And that's what happened in our case. And it didn't happen overnight. I mean, but now, we haven't even thought of it in years, because that's just what he does now. So that's a perfect example of trying to find and identify a replacement behavior to take over that problem behavior. Did you have a question?
Yeah, so, this is wonderful. How do you approach this with like a nonverbal child?
Yeah, no, perfect example. You can use an iPad, you can use visuals, they can have a sentence strip or of some sort. I mean, I'm old school where we used to use sentence strips, right? But a lot of times kids have Proloquo on the iPads, so they get the iPad and they say, no thank you, or I want juice, or please stop, or whatever. It can very well be communicated, and I talk about this later too. A lot of times the issue with the tantrums or the challenging behavior is because a child is frustrated because of communication. So what you need to do, or what we all need to do, is figure out how to get that child, how to allow that child to communicate to us. And that goes for nonverbal kids as well as verbal. So the nonverbal children are able to do this through visuals, picture strips, Proloquo on iPad. There is a way to allow them to communicate so that the tantrums will hopefully be reduced. And a lot of times that's the case, is it's due to frustration, from, trying to communicate, or lack of being able to communicate. So does that give you a good example of replacement behavior? And so again, I don't want to get too technical, because I know that's what I do, but you want to reinforce the good behavior, and you want to increase that good behavior, and not reinforce the bad behavior. And so if you continue to reinforce the good behavior and they say, oh, I'm getting what I want, you know, kind of through this and not through this, hopefully the other behavior gets reduced. Other examples of this, that's my personal example, which is a great, it really is a perfect example for, because I know all parents have something that the kids get upset about, and that's the key, is trying to find a replacement behavior. In most cases you're able to find one, not always. I mean, sometimes it's not the easiest thing to do for some kids, but it can be reduced if nothing else. It may not be eliminated, but they can be reduced, and we'll talk about this more. The problem behaviors may get worse before they get better, because they might be used to, you know, getting what they wanted through these behaviors, and now all of a sudden they're not, because something's changed. So that can be an issue too. Now, punishment we talked about is reducing a problem behavior. Now, like I said, as behavior analysts, we try to focus on reinforcing good behavior. You don't want to try to punish and reduce a bad behavior if you don't have to. This is our first approach. Obviously, it doesn't always work every single time that way. One thing when it comes to injury, so you know, if somebody is being harmful or injurious to others or to their self, then sometimes you have to take the punishment technique because it's serious and it has to be handled right away. And by punishment, I don't mean you necessarily smack the kid, but you know, you remove something from them right away, you know, of some sort that they realize like this behavior is unacceptable. So again, there's something we can talk about in the future. The other one, and I've talked about this with Colleen and Kristen, is the approach that's used for potty training. At least this was effective for our son, was more of the punishment approach. So you know, it's not that he peed on the potty and we'd go, yay, woohoo. You know, that was not reinforcing to him. It really didn't matter. However, the approach that I think Frisco ISD uses for the most...
It's called Fox and Azrin.
What is it?
Fox and Azrin is the name of the program.
Fox and Azrin? Okay.
But we don't call it punishment
okay.
for everyone. It's okay. No, it seems like a punishment. It's practice.
Yes, that's a good approach. It's practice. So the approach that they used, and this was the Frisco ISD, this was my son's SLC teacher who used this on him, was Fox and Azrin's approach, where if he peed his pants, then they do this thing where they take him to the bathroom and he has to pull his pants down and sit on the toilet and pull his pants back up and go back to where he peed, go back to the toilet, pull his pants down, pull his pants back up, go back to where he peed, and they do that 5 times. Now, it's just annoying. I think he just found it extremely annoying. So, you know, they told him, or they told us, they said, bring, you know, a bunch of changes of clothes. We're going to start this on a Monday morning. And he was potty trained to the sense that if we told him to go and reminded him to go, he would go and he would stay dry. But if we didn't tell him to go, he would just wet his pants. So they said he's ready to become independent, where he doesn't need to be told. He can just go to the bathroom when he needs to go to the bathroom. So they said, bring a bunch of clothes in on Monday morning. We're going to start this on Monday morning. Well, and I don't know if it's like this with every kid, but they emailed me and were texting me by noon, he was going to the bathroom on his own. Because I think he was like, this is stupid, this is annoying, I don't want to do this anymore. And so he just started going to the bathroom. And my husband and I still will never forget when he came home from, you know, school, and they were like, don't tell him, don't remind him. You know, if he wets himself, we do the same procedure at home. You know, he's busy, he's getting a snack, whatever, and then next thing you know, he like walks to the bathroom and goes to the bathroom. And I mean, we still remember that moment because we just thought it could never happen. So, again, try not to get too technical. That is technically, we don't like to call it punishment, but it's reducing the problem behavior, because when he peed his pants, he had to do this terribly annoying and aversive thing, and it was more valuable to him to just not do it and go to the bathroom. And he would cry and whine because it's annoying. I mean, it wasn't, you know, it's not painful or anything like that. It's just annoying. So it worked quite effectively on him.
I have to add, it works with teenagers too who drop their backpack in the middle of the hall instead of on the hook. You just look and you go, oh man, we're gonna have to positive practice. And you have them go 5 times back and forth, doing it the right way. You can use it for so many things, and it works.
I might start using that on my kids throwing their shoes on the ground. Yeah.
Positive practice. You're probably going to have to do it again in a few months once everybody gets back into those old
Right. So that's an example of where by the behavioral standards, the punishment technique was working, where we reduced the problem behavior and we were trying to eliminate that, and by, logic, he just started going to the bathroom. Okay, now this is a lot simpler to understand than the reinforcement and the punishment. Functions of behavior. This is a huge, huge part of ABA. Basically, when there is a behavior occurring with any of our children, there is a function for that behavior. These are the 4 key functions that we talk about in ABA. Escape, and that can be from anything, from a person. For our kids, it's usually from maybe a demand or some sort of work, or maybe it's even a person that they want to get away from, or some activity. Attention, they're doing it simply for attention. We all have seen that. And I joke, I use this stuff as much on my typical kid as I do on my son with special needs, because the toddlers do the same thing. They have a tantrum specifically for attention. We see this stuff all the time. Tangible, they're wanting something, some sort of toy or treat or something of that nature. And then sensory, and we'll talk about that. This is usually what we call self-stimulatory, and these might be challenging behaviors, and this is also one of the hardest to actually reduce, and it could be things like flapping your hands, jumping up and down. Sometimes kids have some behaviors that there's no reason for it, so it's very hard to break it because they just can't help it, or it just feels good to them. In the case of my son, it was singing, and he loved to sing, and he needed to learn where it's appropriate to sing and where it's not appropriate to sing, because it's just his musical mind. And we still have that issue today, and he knows, shh, he'll say, shh, quiet, and then he stays quiet for a while, but then you just can't help it and you start singing again. So, okay, so how do we use this when we talk about challenging behaviors? It's very straightforward by line. Actually implementing and being consistent is the hard part, and this can take time, especially, like I said, if it's behaviors that have been going on for a long time. So first of all, what you want to do is correctly identify the function of the behavior. In many cases, we do what's called an FBA. It's a functional behavior assessment. Sometimes you don't need it. Sometimes it's pretty straightforward that the child is doing this for attention, but you just want to make sure, because you don't want to be managing this behavior after you've incorrectly identified the function. That's going to be, it's just not going to work. So if the function is attention, it's fairly simple. You ignore the behavior. I kind of want to say you ignore the child, but you ignore what he's doing. You go about with what you're doing in your day, and ignore the behavior. We're going to go into a little bit more detail on this because, if a child is used to getting attention for that behavior, and now all of a sudden somebody comes in and says, start ignoring that behavior, and they're going to get a little ticked off probably, and they're going to say, somebody's always paid attention to this, and now all of a sudden they're not, and they're going to get very upset, and what you'll see is an increase in the problem behavior before you see the decrease. But in many cases, you will see the decrease because they eventually learn this behavior is not getting, the function it's not getting the goal that I wanted. So in the case of attention, you ignore the behavior. Escape, usually, especially in a school setting or even at home, it's an escape from a demand. You're asking them to do something and they don't want to do it. The key is to ignore the behavior, and you have to follow through on the demand, because the child needs to learn that having a tantrum, hitting somebody, screaming, kicking, rolling on the floor is not going to work. It's not effective. Again, it's very easy to write on one line, but actually implementing it can be difficult, because we've all been there, when the child, it's taking 20 minutes, it's taking 30 minutes. But the key is sticking with it and consistency. and we're going to talk about that a little bit more. But that's the key to what you want to do, and I've done it with my child as well, you know. And sometimes if they're so upset, you just need them to do it one little time, but you cannot give up, because if they know that, okay, mom has said I don't need to do this, the next time the tantrum gets worse, because they know, like, okay, if I acted up enough this time and I got out of it, and now it's going to take longer, but I can last longer and make this a little tougher, you know, I'm eventually going to get out of it. So it's harder to implement, but then in the long term, it makes your life much easier. Tangible, again, this is pretty straightforward, and I joke, I use this with my typical kid as much as I do with my, you know, special needs child. You do not provide what they want if they're having a tantrum. So again, and this can go back to the replacement behavior. And my approach personally is firm but gentle, or gentle but firm. You don't need to yell. You don't need to, you know, it could be very straightforward, and you can say, you know, or I understand, like, if they're verbal or nonverbal, how much they understand, but, you know, no, you're not getting this right now. If you're going to act like this, you're not getting it. I need you to sit nicely and ask nicely, you know. And once they do that and they get it, they start to learn this challenging behavior is not acceptable. I'm not going to get what I want. I'm going to get what I want if I ask nicely. Again, this takes time, but it can be done. And then the sensory is kind of what we talked about, which can be the most challenging, is if it's a self-stim behavior. So if they're not doing it for any of the other top reasons, that they want something or they're trying to get out of something, which those are honestly easier to handle. If they're doing it purely for a sensory purpose, and, you know, sometimes it's even self-injurious behavior, you know, like they're banging their head and they just can't stop, those are the most challenging to try to stop or eliminate or reduce. Again, you try to find if there is a replacement behavior that can use the same level of function for them. Yes?
Will you be touching on the tantrums, if they get really worked up and you need them to calm down, what to do to help them calm down? Because I'm assuming we don't expect them to know how to calm themselves down at this point.
Yeah. I don't have it in this specific. Yes. That's a very good question.
Like in our house with my non-special needs child, I can help her through deep breaths.
Sure.
And we kind of make it fun, and I'm like, pretend like you're blowing out the candle,
right,
or the cake. But my special needs child doesn't necessarily buy into that the way the other one does, or hang around long enough.
Yeah. Is he higher functioning, or is he?
It's both she.
Oh, sorry, she.
It's really just it's speech for her. She's
okay.
just not verbal, and she gets really frustrated.
Yeah.
And I'm trying to understand, and so, you know, if she's throwing a fit on the floor.
Yes.
You know, I need to help get her calm before I can.
Right. Is she verbal enough to repeat what you're saying, or no?
Depends.
Okay. The reason I'm asking, and whether it's either text, like visuals, or iPad, or if she's able to say it, and I've seen this work, you know, and it depends on the child, obviously, but just giving them the tool to tell you that they're mad. So if she's able to say, I'm mad, because a lot of times that's what's happening, is they're getting so worked up and they don't have that outlet to say, I'm upset about something. And so sometimes it's as simple as providing them the communication tools to say, I'm mad. That's one way that I've done it in the past. Again, it depends on every child. Sometimes it is time, sometimes it just is a matter of time, and you need to allow them to calm down before you can actually start reasoning with them or saying why you're doing what you're doing. But
We have some visuals for that on our website.
okay.
Because, yeah, and those are things you want to teach when she's calm, so that she can then, you know, it takes a lot of time.
Yeah.
It takes a lot of teaching when she's in a calm state.
You just letting her calm herself down?
Well, you're giving her some.
You're giving him the tools. Giving her the tools.
You've already taught her how to do that visual when she was calm. So then you just show it to her as a reminder of what she should be doing. Because sometimes when they're in that state,
right,
there's really nothing. You just have to
right.
them. But teach them, You want to give her the tools.
And that's a good point. You're not teaching them right at that moment, I'm mad. You're teaching them when they're calm, but then next time they're mad, they're able to provide that outlet or communicate using those tools. Yes?
So,
oh, sorry. I'll go back.
Those functions. So with escape.
Yes.
So I don't want to go to school this morning.
Yes.
You
Yeah.
have an hour to get ready.
Yes.
And there's a tantrum.
Yes.
Can you give me kind of like a walkthrough of what you would do?
You guys tell me how you would handle this. I would kind of dig my heels in and say, you have to go to school. You know, you can't give in to that.
Right. So she ends up in school
Right.
every single day.
Okay.
Except when she's actually sick and I have
Right, sure.
I'm totally okay with that.
Sure.
But there's I'm going to kick, I'm going to scream.
Yes.
I'm not going to eat breakfast. I don't like what I have to wear today. I don't want to wear that pair of shoes. And then you go down the list.
Yes.
Every single possible thing until that kid is at school.
Right. Do they?
Kind of drains you a little
Oh,
bit.
absolutely. Absolutely.
First thing in the morning.
Yeah, you need enough coffee to handle that too. You need at least that first cup of coffee. What was that? Here's the thing.
You're not alone, first of all.
Yes, you're not alone. And that's not just special needs kids either. Right, right.
I know, but so you try different strategies, but I'm just thinking.
Yes. I mean, again, it depends on each child. Every child is going to respond to all of these things differently. One approach I would take, again, just as a start, just to see if it would work, is ignoring all of that, if that's possible, and just going through the motions. Put your shoes on, put your shoes on. Because sometimes they are looking for that reaction from the parent, and that's what's going on. And if the parent doesn't give that reaction, now they're like, well, what's the whole point? I might as well just put my shoes on. So that would be the first approach I would take, is not react. And I know it, again, I mean, with all these lines, they're a lot easier said than done, but, and again, the same thing may happen because, is it he or she? She is so used to getting a reaction from you. I don't know the whole story, but she's used to the fight or the reaction or something. So if you don't provide a reaction, let's say, not that you're doing it tomorrow morning, but let's say tomorrow morning you don't give her the reaction, she may actually be worse, because now all of a sudden mom is not responding to me. And she's always responded to this and talked back, and we get into our little fight, and now it's almost like you don't care, but that's not obviously what's going on, but she wants the reaction. So I would almost do that, and again, you guys tell me if you guys are okay with that. I would do that for a while and say, is she aware enough to understand and reason with on this, or no? Yeah, okay. So again, I would just go back to ignoring the behavior, because I would eventually, after a few days, say, what's the point? You need to go to school every day, so let's just put your shoes on, let's just put your backpack on, let's just eat your breakfast, and we're gonna go. And the whole fighting part, and again, it's easier said than done, is, it kind of takes away from her reaction that she might be looking for. That would be the first approach I would take.
And along with the non-reaction, you would be giving a visual to her.
Yes.
A visual reminder of, and it takes you out of it by showing her, this is the steps that she got.
I was just going to say, otherwise, I was going to say, if you have something that she checks it off or she moves it to the done pile or whatever, that, okay, that worked for like 4 days.
And we had a reward at the end before she goes to school, and she got super excited about it.
Yeah.
Fizzled.
Oh yeah, fizzled.
And sometimes giving her something to look forward to.
Yeah.
Something either on the way to school that, something, the carrot, what's going to get her there. We just had a situation at school with a teenager who wasn't getting school. As soon as she made some friends that she looked forward to seeing in the morning, she was not a problem. It disappeared. So maybe you can carpool with someone. So she'll look forward to being in the car with that person. Or maybe you change it up and you walk. Maybe she'll enjoy that. Look at different things to give her to look forward to.
One of the tools that I'm going to be talking about later, and this kind of goes to this approach and it goes with the visuals, is called first this, then this. And I think a lot of you may be familiar with this, and you've probably already tried some format of that. But let's say maybe she does all of this with no fussing. If you do all this with no fussing tomorrow, you get give her a birthday cake. I mean, give her whatever, give her whatever she wants the first time. And then obviously that gets, whittled down. She doesn't get that every single day. But maybe if she can go through that and, maybe it's a treat at McDonald's or whatever her big reinforcement is, you could say, let's do all this, no fussing, no fussing, no fussing, no fussing. Awesome. Now you're going to get, this at the end of the day today. We're going to go get frozen yogurt or whatever. That might be another option to take too. So we could talk more about that also.
If you're in Sanctuary and Lending Library on a Friday. Yeah.
Yes.
Individual advice from you.
Set
tomorrow.
Talking about the problem when it's not going on.
Yes.
So maybe
Yes.
have a discussion and I can
Absolutely.
I don't know if this would help her with my son who spirals, and then
There's no talking. There's no talking at that
so
point.
I have found that it's useful to discuss a situation prior
Mm-hmm.
with him, and then remind him what we talked about when she's doing it, and say, or even the night before, have
Yes.
her pick out everything, have her pick out her clothes and her shoes, and then remind her the next morning, these are what you put down, or give her choices if she changes her mind. But remember we talked about this, but that's what
No, and that's a great point. It's very difficult to talk to them at that moment, but talk to them. This goes back to what we were talking about as well. Go back when they are calm and say, all right, let's do this. Let's pick your clothes out. Let's pick your breakfast out. Let's do this. Let's do a check. No fighting this time. No fussing this time. And maybe you talk to her about, if you can do all of this tomorrow with no fussing, we're going to go here, after school. So, that's a great point. You want to communicate all this before, not at the time, because that's, worthless, obviously. So, okay. Any questions on this, on the functions of behavior? Again, this is something we talk about a lot, and I think you guys do the same thing when you're working, at the homes, is why is the child doing this? And then you kind of manage your own behavior on how you handle it, based on that. Yes?
I have a question about the sensory.
Yeah.
My son he's on the spectrum.
Yeah.
But his struggle is transitions, just from,
Yeah.
Let's put on your shoes to put on your backpack, or let's get on, let's open the door to get out. If he misses a step,
Yes.
he completely just
Breaks
melts
down. Okay. Yeah. That's a
And
tough one.
It's so hard because we get to situations where something happens that's beyond our control.
Right, and you can't help it,
And,
but now something has been missed.
Yeah, how do you address that? Like, how do you, what steps could I do to help make life a little bit easier for him? Because, for example, one day his big thing is, his big show of independence is when we go to the gym every morning, he likes to open the door like a big boy.
Yeah.
And one day a gentleman was nice enough to open the door for us,
Right.
and it sent him.
And
into
it set him, and it
tailspin.
just ended. Right. Yeah. I
And the
completely
rest of
understand
the
that.
day
Was gone.
Was gone.
Yeah. That's a tough one. Were we past no return? Was there any way that he could go back out and open the door? Yeah, it was already done.
It was done.
It was done.
It was the fact that he couldn't do it. It was taken away from him.
Yes.
And and then I'm just trying to
And that you're just managing it.
Yeah.
You're
like,
not,
How can I help him?
that's, again, and how old is he?
He's 4.
He's 4, and he's nonverbal.
No, he's verbal.
He's verbal.
He's
Okay.
Semi-verbal.
Verbal enough.
Verbal
Like he
enough.
can communicate
Yes.
some of his basic wants and needs.
Yes.
You guys want to chime in on this one? This is
It just sounds like control. If you could give him some control, like, do you want to go through the left door or the right door? Do you want to wear this blue shirt or this red shirt? It's if you can give him ways to control throughout his day from the morning, he might be able to handle when he doesn't have control a little better.
Okay.
yeah. And then I think, are you using picture schedules or visuals at home? That might,
We use some.
Okay.
Yes. Like I said, this is just something that he's grown used to
Yes.
over time, and it's one that it's like a trigger.
well, and I completely understand where you're coming from, because in your world, if you can control it and he can control it, but guess what? In the real world, sometimes you're not controlling every circumstance, and
And how can I have him handle, hey, just let it go?
Just let it go. Here's my example with my son, who is, you know, anybody who meets him, he's like probably like your son. He's verbal enough to provide his basic, you know, to communicate his basic wants and needs, but you know, you're not having a conversation with him.
Right.
He's very sweet-natured. He's easygoing. We can take him places. He's awesome. But if there's a song on, or somebody's singing a song and stops that song in the middle of the song and it doesn't end, forget it. I mean, there's nothing we can do. I mean, now you're going to have a 20-minute meltdown, and there's literally nothing we can do. And we just know, like, oh boy. And nothing bothers him, but it's all music to him. So I wish I had a better answer. Sometimes it's in cases like that, you need to try to manage the environment as much as you possibly can. Sometimes it's just not possible, but again, we could probably talk about tools again for him, if there's visual tools for him when he's in that situation. Again, we would do it beforehand and provide, and I think sometimes as easy, and you know, they're going to be upset because these things like this upset them, but if they're able to just communicate, I'm mad, or I'm upset, or I wish I could have opened the door, and maybe you even say it and he says it, and it's just getting that out, it may allow him to maybe calm himself down a little bit more, or maybe not last as long. Again, the tools, I think the visuals help.
And you can do role playing, like, you know, after a situation like that happens, then when he's in a really good mood, he's, you know, had a good sleep and he's fed well, you can practice somebody else opening the door instead of him.
Yes.
Kind of do a bunch of practice.
That's a very good point, and I've done that too with kids, is something like that, whether it's the door or something along those lines. With my son, it used to be the elevator, and we couldn't pass by an elevator without him wanting to go in it, or he would have a tantrum. Well, that was actually a goal, is we are going to walk past an elevator and we're not going to go in. And you'd have the tantrum, but it almost desensitized him, where now he still gets elevator rides, but we can actually walk past an elevator and not go in it, and which is huge. So again, sometimes it's a tough one, because now you're putting him in a situation where he has the tantrum, but maybe he's learning that, okay, it's not the end of the world. It's okay, and I can survive it. So that's another option, is it almost can be a goal of his, you know, something along those lines.
Practice it when you're not like in a crowded mall.
Social scripts would help too, yeah. We're going to go through some of the home strategies now. Those were the key principles. There's other principles. I wanted to go through those key ones with you. Again, we've talked through some of this, but I'm going to go through in a little bit more detail. When you're trying to reduce or actually eliminate, let's say, a problem behavior, and eliminate is a tough word because it's very difficult for any child to never have, you know, a tantrum again. But, you know, for the most part, kind of like Sean's lunging at us, we've eliminated that, which, you know, is woohoo, you know, like huge. What's called behavior extinction. And what this is you try to, and this is specifically for behavior that the function is attention. So a lot of times kids are doing this for attention of some sort. You know, they want to get mom and dad upset or angry, or now everybody's focused on them or something, you know, something along those lines. The key is to ignore the behavior, but when we're talking ignore the behavior, you ignore everything. You go about your own day. You do not provide them any attention at all. Now, like I said before, you know, the kid's going to get a little ticked off about this, because they're used to you or somebody providing attention, getting all so worked up and trying to figure out what's wrong, what do we need to do, blah, 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 you know, da, 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 da. If there's no other function of the behavior besides attention, you ignore this behavior. Now, what's going to happen, and we talked about this, is you will see an increase, and you may see a fairly severe increase in behavior before it gets better, because they're going to try really, really hard to get your attention, because it's worked in the past, and now all of a sudden you're not giving me the attention I needed, and you're not doing what you used to do, and now they're going to ramp it up, you know, and it could last for a while, but eventually they're going to figure out this is not providing the function that I need it to provide. And the other part of it is maybe you provide that attention when they are behaving appropriately. And so now they're getting reinforced for that appropriate behavior, and they're not getting the attention for the inappropriate or the tantrum or the challenging behavior. So this can be very difficult to implement, and it's specifically called an extinction burst in ABA language. They have a term for this because things do get worse before they get better. And I've seen this many times, and I'm sure Colleen and Kristen have seen this many times as well. And things do get better, but they do get worse before they get better.
We always like to tell parents, if it gets worse,
it's working.
aha, it's working.
It's working. Right. My big point here is consistency is key. This is huge. The reason this is huge is if one time they get the attention, things are so bad and you're like, I can't do this, I gotta, handle this, blah, 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 blah. That child is going to know that, oh, if I just ramp it up, I'm eventually gonna get this attention. So this is very difficult to break, but it can be done. It could take a long time, but again, it can be done. So the parents have to be in it completely and committed and invested and realize that this could get a lot worse before it gets better, but it does get better. Yes?
One of the eyeless son that escalates,
Yeah.
excuse me, that he likes to throw things or hit.
Yeah.
And you can't ignore that, then you don't want to get into that.
Yes.
And that's where I'm he'll find anything in his eye level. He's only 3.
Oh.
But he's got major behaviors of throwing.
Of throwing?
Damaging things, throwing things.
Is he hurting others?
Yep.
See, no, that's a tough one.
You don't want to give into it.
Exactly.
That's what he's wanting.
Right.
I can't let it hurt his siblings.
Right. Do you guys?
Clear the environment.
Yeah.
Be ready. Just say, this is my goal. We're ready for it. Have big pillows to protect yourself so you can stay in the environment, but clear out anything breakable that's going to stop you from being consistent, and clear out the people that might get hurt.
I mean, I was going to say you almost have to ignore it, but you have to put the environment in a place where others are not getting hurt. And I know, again, sometimes you've got other kids and it's not always easy to do, and things are going on in the house, but if he's 3 and he's doing that, then it could get worse and worse if it's not stopped now. Right. And
something they do as they're escalating, what you'll see if they already have those behaviors and you're ignoring those behaviors that are already pretty serious, he'll start hitting himself.
Yeah.
That's always the next thing. And it's so amazing because you watch him go. Like, first I scream, didn't work. Now I'll hit Mom, didn't work. Now I'll throw her special vase. Wow, that didn't work. Okay, well now I'm going to go after the dog. Geez, that didn't work. Okay, now I'm going to hit myself.
Mm-hmm.
Bingo. A lot of times that works. So you just want to protect the child also. If they're banging around the floor, put a pillow under their head without saying anything, without looking. Give as little reaction as possible and just try to work through it, but make sure everyone's safe.
And I know you've been there, and we've been there. Not with my own child, but when I'm working with kids, especially when a person comes in and now, they're not too fond of me because now they've gotten away with all this stuff. But if I show up and guess what, this isn't going to work on me, and they'll try. And again, it's like you can stay gentle and firm, but no, sorry, you can smack me, and we all have battle scars, and you can scratch, and it's just not going to work, So again, it escalates. But if it's like this at 3, then I would suggest, either talking finding some way to ignore this and manage that environment and stop now, because it could just get worse, and he'll learn that I'm just gonna ramp it up. So I know it's hard. I get it. Any other questions? Yes.
Continuing with the same conversation that was going on. So in such a situation, because I have a 3-year-old and pretty much it's the same way.
Same.
So does timeout help with kind of removing them from that particular situation? Not talking to them basically.
Yeah.
Just kind of taking them away and putting them somewhere else.
I mean, I would say, and you guys tell me what you think, but I would say yes if you're doing it correctly. If you're putting them in if they're staying in that timeout, if they're staying there, and they can be kicking and screaming in that chair, but you're not providing any attention to that, then I would say yes.
It's effective for some, I'd say. But
Yeah.
not all.
Yeah.
It doesn't work for all. But that's the key, is no attention.
No attention. You just need to not provide any attention. Yeah. And then again, I go back to consistency, because this is the hardest part, is being consistent. Because if it's not consistent, if it's 70% of the time you're doing it and 30% of the time you're giving in, those tantrums are going to continue, because they're just going to know that, well, one of these times I am going to get what I want and I'm getting the attention, so that will not stop. It literally needs to be 100%. And it's hard, but that's, and I would say you'd agree.
Well, that's a slot machine, right?
Right, exactly.
Reinforcing. Okay,
Right.
So you know that at some point, when we go to the Choctaw, eventually the slot machine's going to give you something, so I'm going to keep thinking the next time it's going to give it, next time, and that's the same with our kids.
Right.
Not that I go to Choctaw.
Oh, not that you go to Choctaw. I thought some of you guys could appreciate this one, so. Thank you. I got one left. Okay, we talked about some of these as well. First this, then that. And some of you may already be using some form of this. And this also goes to visuals and schedules. So if a child is able to anticipate and understand what is going to happen, and then if they know if I do step 1, step 2, step 3, step 4, then I get my iPad, or then I get my juice, or then I get my, my swing time, or whatever it is, that they are more likely to sit and focus and do those tasks than if you're just sitting with them and telling them, you need to do this, and now you need to do this, and now you need to do this. It's a lot harder for them because they don't know the end. If they're able to anticipate this, for kids who can read, you can literally just write it on a piece of paper. For kids that are not able to read, you can do visual schedules. Some people do it in Velcro, some people do it on like laminated, and then you can check each thing off. But in our house, First Then works wonders for everything. So, Sean helps with chores now. So he unloads the dishwasher. He takes out the trash for us. And he's 14. So like any 14-year-old, he's not as verbal, but he whines, when you ask him to unload the dishwasher. No 14-year-old wants to do that. And it's like, and I'm like, first unload the dishwasher, then you get your iPad. Okay, I will do it. So again, this can take a while to get to this point of training, but once a child learns, I do this, 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 and this, and then I get my reward, this actually can help quite a bit. Use visuals if necessary, yep. A big one on this one is taking a break. I would say a lot of times when they're doing work in school or maybe at home and they need a break, first do this, 1, 2, 3, and then you get your break. And I've told parents, and I've used this many times, sometimes I just get a blank sheet of paper and I write with my pen 1, 2, 3, 4, 5. And the kids actually enjoy being interactive and part of it. And so I'll say, I need you to do this 5 times. I use this at home with my child. I use it with the kiddos that I work with. I need you to do this 5 times. They do it once. All right, get your pen, cross it off. They cross it off. They do it again. And then you can write or put a picture of what they need. Then you get your iPad. But literally it can be as simple as writing 1, 2, 3, 4, 5 on a piece of paper. 1, 2, 3. If that's, if 5 is too much for them and you want to start at 3, that's fine too. So this is a very effective tool, and it's an easy tool that can be used really right away. And again, if your children aren't used to these tools, they may push back initially, but again, if you're consistent and say, I need you to do this 3 times, and then you get your break, or then you get your iPad, they will learn that, okay, I'll do it once, I'll do it twice, I'll do it a 3rd time, now let me go. But they'll do what's asked of them. So and then token economy, I'm sorry, I think my thing is getting, you can hear me right? Token economy is similar. It's basically like stars on a board, and I think a lot of the teachers use this here. And so, hey, you did this, you get a star. You did this, you get another star. And again, it can be, a lot of times people have like a laminated thing with Velcro, and you can Velcro each star on there. So this can be used to get a child, if a child tantrums over something they're supposed to do, maybe you say, okay, I need you to do these 2 things right now. Here's 1 star, here's 2 stars, and now you get, your break or what you want. Yes.
The token economy doesn't work for my kid.
Yeah.
But I tried with the iPad. He was addicted to that.
He was what?
Addicted.
Yes. Yeah, and I think that's we're seeing that with all the kids.
And he wants the whole day.
That's I think every child, special needs or not, is getting addicted to the iPad, and that's a good point. If there's another reinforcer that can be used instead of the iPad, I'm not a huge fan of using treats that much or edibles, but I know for a lot of well, yeah, a lot of them are picky eaters too. But sometimes there's one very special thing that they don't get often, or something. Maybe it's gummy bears, maybe it's goldfish, maybe it's, you know, that is maybe it's something he doesn't get very often. That could be something. But I hear you. A lot of these kids they get addicted to the iPad, and the problem is I know it's still used as a reinforcer because that's what's the most reinforcing item to them. So they will get done with all their work because then they get their iPad. Now the hard part is, and we used to have that issue again, we have to work through it, and we did, is telling them to stop the iPad when you ask them to stop it. And now it's time to stop the iPad and go back to work. That can be difficult too. There are ways, again, it's the same thing. You have to stay calm and follow through and get them back to their work, and then the iPad. We used to have that issue at home too, and luckily that's not now, but again, it takes work, so, and consistency. So this is not, again, you know, it's easy to write all of this on a PowerPoint. Implementing it is not, it's doable, but it takes commitment and a lot of hard work from the parents too. So
But it's worth it.
it is worth it, I will tell you, and I'm one to, it makes your life a lot easier in the long run. A lot easier.
Put the work in now. So
Yes,
it's
and the younger they are, the better. Do it as young as possible, because now when they're 14, my son is 6 inches taller than me, you know, so if he's aggressive, it's a lot different than when he's 4, you know, so you want to eliminate or reduce or manage all of this at an early age, and they can learn. They will learn, you know, they will tantrum because it's worked for them, but if they start to learn this isn't going to work, they will change their behavior. They do. We've seen it time and time again. Yes?
I'm sitting here trying to remember the name of it, but there's actually a program you can install on all the devices in your house, and you can control and turn things off too.
Oh,
You know what I mean? Like to reinforce.
I don't know this.
Yeah, Disney has one.
Yeah, so you
There's
can
a
say,
few out there.
like, your
Yes.
reward for doing this is you have 15 minutes on the iPad.
Right.
Whatever, and then you set it,
Yes,
and it turns off.
And it turns
You don't
off.
touch it.
right. Okay, see, now that would not work with my son, because if he was in the middle of a song and it turned off, then the meltdown would happen. But what we would do, and I use this a lot, is you set a timer, you know, and so on your iPhone, and I use this with my kids even now, you know, that I'm working with. Okay, here's your iPad, you get a minute right now, and they know they get their minute. So like if this was my son, he would get his minute, but song finishes, done, you know. So, but with my other kids, they don't even, to them it doesn't matter. When the minute is over and they hear that alarm and they're used to that specific sound now, that when that sound occurs, that means time is over, boom. And again, we still have issues where they're like, nope, I still want it, which a lot of typical kids do, but like, nope, sorry, we're done, you know, and they learn that, okay, I'm done and I'll get it back. You know, then we do the, 5 times, and okay, you get to, let's cross off another 5, and then you get, another break. So,
Something great that a lot of people have now is Alexa, because then it's Alexa's fault. It's not your fault. And you say, Alexa, set timer for 5 minutes.
oh.
And then the timer goes off. I just heard somebody say, I'm so afraid my child's first word is going to be Alexa.
Okay. We talked about this, and I'm going to get into a little bit more detail here. We talked about identifying a replacement behavior and frequently reinforcing that behavior. And I'm going to, give you an example of this. Waiting. A lot of our kids have a problem waiting, like waiting in line or waiting, at the table for whatever. And that's a hard one. How do you, and if they get antsy, how do you don't punish the antsiness or whatever. So what we started doing, and not just with my son, I do this with my other kids and clients, is you provide a lot of reinforcement initially, a lot. Whether it's verbal praise, and again, I'm not a huge fan of using treats that much, but if that's sometimes what it takes, you know, give them a goldfish, give them a gummy bear. You guys okay with me saying that? Yeah. Sometimes that's what works. So what you would do is you would reinforce frequently, initially. So let's say they're waiting in line, and, you know, Sean, you're doing a great job waiting in line. You know, here's, you know, whatever, a gummy bear, you know, and now he's learned, like, okay, and, you know, he understands enough to know I'm waiting and I'm doing a good job waiting, you know, and so now, and once again, you know, and what you do is you reinforce often, and then when they start getting used to it, you kind of lengthen the time period in which you need to reinforce. So I'll give you an example of my son now. So he's good at waiting, but he's not very good at standing still. So he is a mover. Like he literally cannot stand with 2 feet. We timed him like more than, I think we got 7 seconds if we're lucky. So he'll stand in a line, but you know, there's always this, or then he's kind of going this way and he's kind of going this way. And so now a new goal for him right now, and just so you know, I don't do the ABA therapy on him. He's got his own BCBA and therapist, but his goal is to increase the time that he stands in one place. And we do 5 seconds, but now what happens is if at 5 seconds, verbal praise might be enough for him, so we say, yay, great job, you did 5 seconds. Or if he gets an extra goldfish as his treat, you know, you get an extra goldfish. So now if he waits 5 seconds and then another 5 seconds, now he's got 2 goldfish. So what happens is you increase that time frame of that reinforcement, and then hopefully what you're doing is you're increasing that time that he actually is able to stand in one place. So waiting is another, you know, we had this issue with waiting with him. Now he's great at waiting, but we reinforced frequently initially, and then you can start reinforcing in longer and longer intervals until they start to, you know, they're almost kind of doing it on their own, and it's not even that big of a deal anymore. Does that kind of make sense? Again, this also goes back to reinforcing the replacement behavior as opposed to punishing the challenging behavior. So instead of yelling at the kid for running away, you're trying to reinforce often the fact that they are standing here and waiting.
Especially if they like attention.
Yes, especially if they like attention. This works great on the kids that love the attention. Absolutely. Yeah. So a time may come where there's no reinforcement needed, and now they're just doing this on their own. Again, all of this takes time, and it's not, some of this can be easier. A lot depends on the child too. So some kids kind of pick up on this pretty quickly. Some kids, it can be tougher. It can still be done. They can improve, but some kids it can be harder. You know, the progress may be slower. Some kids are like, oh, I get it, and I get to sit here and you give me attention. Great, I can do this, you know? So it all depends on the child, on what level of progress is made, but all kids will make some progress on this.
Just a heads up, we have 6 minutes.
Okay, all right, thank you. We talked about this a little bit, is a lot of times the reason for the behavior is a lack of opportunity to communicate. So this goes back to what we were saying as far as communication, teaching yes and no. Sometimes they just want to be able to say, no, I don't want to do this right now. And it can be for nonverbal kids. You know, we've used a green yes and a red no. And sometimes people have them even on their keychains, or you know, they have some way, or on an iPad where they're able to just, you know, hit yes or no. And that actually reduces a lot of aggression sometimes, because they just need a simple way to communicate. For older kids or kids that are more verbal, sometimes they just need to be able to say, I need a break. You know, that I can't work right now, I need a break. Instead of rolling on the floor or flailing or whatever they do, they need to learn that's not gonna work. They're not getting their break that way, but you teach them these tools to say, I need a break, or you provide the visuals for them and say, do you need a break? And they can hand you the break picture or something along those lines. Okay, this goes back to, in some cases, my point here is that we use these ABA strategies and they can all be very effective. Sometimes a child is just not ready or mature enough, and we had this experience with our son the first time that we tried to potty train him, and he just wasn't ready. He was not mature, you know, I mean, he was older, but he was not himself quite ready to get it. So in a lot of cases, sometimes you table it and you come back in 6 months and say, let's try this again. You want to use these techniques, but in some cases, the maturity level is just not quite there. I would say potty training is a good example for that. You need to make sure the child is kind of ready for it. And again, sometimes the reward, the behavior is almost too rewarding. I had one kiddo who loved jumping from heights. He loved climbing up the side of his parents' stairs and jumping. And there's nothing we could do to stop it. And when it gets to that point, now you're just managing the environment. Now you need to either blockade certain areas, and this is for his own safety now, you know, we're talking safety. So he literally, nothing, I mean, we tried reinforcing other things, we tried the punishment, we tried, you know, it was almost self-stim, like he had to do this. So at that point, you need to manage the environment where it's safe for the child. So, you know, these kinds of issues do come up as well. You know, being realistic. Okay, I went back to this and then I'll be done. This is my last part. But consistency is the key. And I can't stress this enough, because if there is not consistency, it will not work. It's as simple as that. And I think you guys would agree with that. Yeah.
Absolutely, and it needs to be consistency with your significant
Both
other.
parents, both sets of parents.
Siblings, make sure that it's a family goal.
Yeah.
It should be a family project.
Yeah.
Call it a project. Yay! Put a reward on the calendar that everybody's going to get, the whole family, when you succeed in this goal for your child. But you've got to be on the same page. You have to have a plan, and you have to all be in it.
Yeah. Final thoughts. Oh yeah, this was my favorite. So ABA can be used on anybody, basically. You know, we talk a lot about special needs here. Again, I use all this stuff on my typical kid. I joke, we use this on our spouses, you know, so you reinforce the behavior that you want to see, you know. So, but these tools and these strategies can be used any environment, any person. You know, our focus here is on special needs kids and challenging behaviors, but these tools can be used in a lot of different places. Yes?
Is there an age limit?
No. No. I've worked with middle-aged adults with special needs. No. And I've done ABA and set goals, and yeah, no. No.
So I said to my husband once, hey honey, how about we clean out this little closet here and then we'll get some ice cream. He's like, okay. I'm like, I love it. Reinforcement's awesome.
Yeah, this was, I don't know if you saw this, I don't know if you can read it on there, but it says, every time I wash the dishes, my girlfriend puts on ESPN. Is she behaviorizing me again? So, no, there is no age limit at all. Things can always, it's harder. The older they are, the harder it is, obviously, because they had a history of this behavior being reinforced, whether it's attention or getting out of things or whatever. But yeah, but there is no age limit at all.
The psychologist had told me at his last appointment that he was too old and totally dismissed the ABA therapy.
I think a lot of people, especially maybe neurologists, they think of ABA for preschoolers, and that's, you know, for the most case, or school-aged kids, because they're learning their fundamentals. They're learning letters, they're learning numbers, they're learning how to communicate, they're learning how to read, they're learning, you know, self-help skills, those kinds of things. But no, I would, if you would talk to any BCBA or anybody who works, any person at any age can benefit from this and make progress. So, yes.
I understand that consistency is the key. So how do I have consistency at home with my 4-year-old son that I can ignore the behavior?
Yeah.
But then when he's at daycare, at preschool, what do I tell the teachers to do if he's, you know, he starts hitting another child or has his upset moments and, you know.
And see, that's a challenge. With a lot of the kids we work with, if they're in the special ed district here, the teachers will be on the same page. Now, if they're at a different school, it would be critical or crucial for you to talk to them and say, we have to be consistent. I understand that it would be hard because I know they've got other kids and you can't ignore a behavior when they're hitting another child. I get that. So that challenge is there.
The more variables, the harder. And we do see that it's harder when they're in multiple environments. Best thing you can do is get everybody around the table.
On the same page, yeah.
And provide the visuals, provide the tools that you're using, and make sure they have what they need. Or videotape how you're doing it at home so that they can see it. But it is harder, the more variables.
And I think if they are taught some of these basic principles and not the, you know, details, but this is why we're doing what we're doing, and that we're hoping to see that this behavior reduces, you know, if they're able to understand the purpose of it, then they might be on board. But I do get it that if you can't ignore that behavior when they're hitting a child at a daycare. But yeah, to Colleen's point, it just makes it harder. I mean, I was going to say it can be done, but usually if it's not across all environments, then it's very hard to reduce the behavior. Yeah.
We're going to have to wrap
yeah.
it up. I'm sorry. We actually do have another behavior training, if you can make it during the day, next Friday here at the ECS at 8:30. So that was on our monthly events. So just email me if you have any questions about that. Are there any other announcements or anything?
No, just thanks. Okay. Big thanks.
Thank you so
Thank you.
much, Monica.
Oh, no, thank you guys. You guys were great. Thank you. Great questions.